Here to talk on self-quantification as a driver of behavior change, Dr. Joseph Kvedar. Please help me welcome him to the podium.
Thanks, Joe.
Thank you.
Good afternoon, everyone. It's exciting to be here. Can I have the slides, please, Mike? So, I've been in this business for now 17 years, and happily for me, I learn every day, and I've made a pact that when I stop learning, I'm going to move on to something else or maybe retire. So I learn a lot, but it's actually not hard for me when people say, what's the biggest insight you've had? What's the aha moment that in 17 years? That's very easy, and what it is that the capacity of individuals when armed with insights about their own information, their own health information, the capacity they have to change their behavior. And I've been thinking a lot about that in the last year and how important quantification is for that, and that's the story that I want to share with you in the next few minutes. Now, what makes it even more special for me is that I get to share this story with little video clips that I've embedded from people in our system, in the Partners Healthcare system, that are using these tools to care for patients. In one case, a patient. In one case, a nurse from Partners Health at Home, which is one of our partners. And another case from a pharmacist who's using one of our programs. So you'll see those, and they tell the story actually much better than I could. But I'm getting ahead of myself. So I live in Lynnfield, Massachusetts, north of Boston. It's a lovely community, very New England. You can see our circa 1650 town hall here. And when I'm driving down the road from time to time, I run into one of these. And I'm curious how many people have encountered one of these dynamic speed displays. All right, now, leave your hand up if you didn't slow down. All right, so there's a few people who admit. We're going to come back to that. I'm guessing that's an underestimate of who didn't slow down, but we'll come back to that. I'll tell you why I think that way. So most of the time, these things, they cause behavior change. You slow down. It's interesting, though, when you think about it, it's not new information. You had your speed in front of you on your speedometer, and the speed limit is posted regularly, but somehow the juxtaposition of the two and the flashing light promotes behavior change. And I've asked a lot of people about this. Some people say, well, isn't there policemen around the corner? No. You know, I'll come back to that notion too, because I think that's interesting. But for whatever reason, what it tells us is that feedback loops change behavior. There have to be four important components. This I took from an article that was published in Wired magazine a few months back. There's got to be some evidence, something objective, and I'll keep hammering away on that. That's the quantification part of the story. Then there's relevance. You have to put it in context for someone. It can't just be numbers. It has to be relevant to their current situation. Then there's consequences, and we're going to talk about consequences. And this model of care, that's really where we as healthcare providers have the biggest role, is enabling people to realize there's consequences for doing something or not, and then finally action that you can take. So really it boils down to three things. Active reflection, you're seeing information in front of you that's got some meaning, you get a chance to think about it. Sentinel effect, which is if I don't do something, someone's watching, and the ability to take action. So I'm going to unpack each one of those for a couple of minutes each. Let's talk a little bit about active reflection. It really has also three components: objective information presented in context at the right moment in a meaningful way. This is really the quantification part of the story. Now, we have had our earliest success in connected health, arguably, in the area of heart failure telemonitoring, which we started in collaboration with our friends at Partners Health at Home in the early part of the decade, and we've been partners with them on it since. And what that involves is patients take or have delivered to their home a set of technologies, a weight scale, a blood pressure cuff. They're responsible for uploading their vital signs every day. And as you'll hear in a moment. If they don't, there's a consequence. And if their weight's out of, or any of their vital signs are out of parameter, something happens as well. So there's a consequence either way. This is Karen Federico. She's one of our telemonitoring nurses. And I'm going to let her share with you how she feels the collection of objective data impact the patients in the Connected Cardiac Care Program.
They're more diligent about also writing down themselves the data that is provided via the monitoring equipment. Now they can see for themselves, my weight's gone up a little bit, what did I do? Many times, it's just the diet. Now they're putting 2 and 2 together with a diet, with their symptoms. And they're seeing, if they go out to eat, look at what happened to me. You know, this really makes a difference.
So it's really interesting how our patients start to see the impact of their diet, their salt intake, their fluid intake, and their fluid management on their condition, and start to manage themselves. And that's really a beautiful thing because it helps keep them healthy from in-home, keep them out of the high-cost part of the system. It improves quality and lowers cost. And now we can track really everything. Now my favorite is on the top right-hand side. I've got one on my hip at the moment. It's the newest iPod Nano, which out of the box has the Nike app built in. You turn it on and you can track your steps just out of the box. And when you plug it in, you upload it to Nike's website. You can share it with others, track your activity, et cetera, et cetera. If you like to run, you can track your run. But connectivity at the sensor level is becoming really a consumer-level commodity, and this is really exciting. You can also track blood pressure, and shown here as well as the Zeo, which allows you to track various aspects of your sleep. And there are many, many more, many more. But the idea is that they're out there and they're affordable, and people can pick them up and start tracking their behaviors. And as a matter of fact, 15% of internet users at this point track some sort of aspect of their weight, diet, or exercise routinely online. And we as healthcare professionals are not capturing any of it. In fact, we're pushing it away saying, oh God, it's lousy information, I don't need that, what have you. We really have to embrace it because it's real information coming from real people when they're not in the office. Let me give you a personal insight that I gained from tracking. Now, pictured here is the Body Media armband. By the way, I'm a living laboratory for all of this stuff. And I'm always got, stuff going on. That's just part of what I do, and our whole center does, actually. So the Body Media armband it tracks galvanic skin response, it gives caloric output, it gives activity level and so forth, steps, what have you. And I rather like to cycle, and so on the weekends, when I think I'm doing something heart healthy, I go out and ride my bike for an hour around the town that I just showed you, our lovely town of Lynnfield. And it turns out that I can burn about 276 calories or so bicycling for an hour, and I think that's a good thing, and life's good. Around this time of year, I unfortunately run into this unpalatable chore of leaf raking, which I didn't used to like at all, and I used to kind of mutter under my breath that I'd really rather be riding my bike, and I'm not doing myself any good anyway, and until I looked at my caloric output for leaf raking. It's actually very good. It's a good workout. So I don't fuss over it anymore. I go out, I put a couple of earbuds in, and I leaf rake, and it's like I'm going to the gym. But that's the kind of insight that quantification, and that's the kind of insight that our patients are picking up on as well as they pick up on these connected health programs and quantify. So that's active reflection. Now, the sentinel effect it's a two-sided coin. The one side is this idea of social desirability bias, particularly as relates to health information and other types of information. We would like to appear to be good citizens, most of us. This is why I suggested earlier that probably some hands didn't go up confessing that they went through the speed sign, because you didn't really want to confess that you went through the speed sign. Some of you, some were brave enough to. That's social desirability bias, and it creeps into anything having to do with health, and that's why we're so bent at our center on objective information generated from sensors, because we really don't trust that people, as honest as they believe they're being to sort of put something in, type something into a website or a mobile app, that we'll really get high-quality information from them. It's not that they're lying. It's just that they're going to up code a little bit or down code a little bit, or maybe forget if they think one's off the charts. It just doesn't work well that way. So that's social desirability bias, and the reason it works is because of the sentinel effect. I think maybe my doctor might see this, or someone, or my social network, someone I care about might see this, and therefore I want to make sure I'm on the up and up. And when we talked about consequences earlier, this has to do with that. Now, I would say that depending on who your doctor is, it might matter. So maybe if this was a doctor you're staring at, you'd really have a lot of sentinel effect. So the sentinel effect has interesting good and bad aspects. It's not just all about sort of holding people accountable and us staring down a barrel gun at our patients. And one of our patients, George Raboy, who's also a cardiac patient and the same program that Karen talked about, has some interesting views on this, and I want to share those with you now in his own words.
It's not only instructional for me, but the nurses gain information by asking me detailed questions, which I have to answer, and then they report it to the doctors. I have to be truthful with them. I can't fudge anything because I can't eat fudge. But there's a sense of security in knowing that people who are medically trained are looking after me. If I miss something, they'll pick it up. I'm very happy with the program.
So you get the good and the bad of it there, and I think that's fascinating. On the one hand, I can't fudge. On the other hand, isn't it useful to know that these nurses in our home care group at Partners are really looking after me constantly, and there's reassurance in that. I think that's a wonderful story about sentinel effect. Finally, the ability to take action, that's probably the most important thing, because what would feedback loops be if we couldn't have the other half of the thermostat or the ability to do something? This whole premise is based on the patient being able to take some action to change their behavior. So I have a couple of examples of that from our own work. This is a fascinating one. This is a simple, really, reminder system called the Glow Cap, which we've done a number of experiments with, and it glows, reminding you to take your medicine. It's what we call an ambient device in the sense that it's sort of flashing off to the side, and if you don't take your medicine in a little while, it starts to play a tune and escalates until you do. And then when you take the cap off, it records that you did. That's it letting you know that it knows you took action. And you get this feedback by way of a weekly email that tells you how well you did. In certain programs, your doctor can get a monthly copy as well, usually by paper, that says this was the adherence. Now imagine those of you who go to your doctor and talk about your adherence, instead of saying, how are you doing? I remember most of the time saying, well, looks like you were 67% adherent, how that would change the conversation. Now we have done wonderful things with this. In a sample that we did, people who had this simple reminder system improved their adherence to their medication 68%. And that's pretty remarkable. Adherence, we've heard earlier today from Bill Schrank, is a big problem. Not that this is the whole solution, but simple reminders can go a long way to moving these feedback loops to behavior change. Two other programs, Diabetes Connect, Hypertension Connect. So they're very similar, different conditions, similar setup. The sensor's different. It's a glucometer in the case of diabetes, blood pressure cuff in the case of hypertension. Same kind of provider involvement. It's usually a nurse or a pharmacist or some other professional looking at a dashboard and seeing, which patients are really kind of out of parameter. Maybe I can go in and help this individual, that sort of thing. And in both cases, we've achieved really good results. In the case of diabetes, a 1.5 point drop in A1C, In the case of hypertension, 69% of those patients achieved a drop in their blood pressure. And what I thought I would do now is share with you, in the words, again, of one of our own providers, a pharmacist called Amy Bilodeau, who's using the hypertension program as a tool for her to help people sort out their fears and concerns about having high blood pressure.
It really helps with getting those readings, especially for people who maybe have elevated blood pressure in the office, and then we don't know what it's like outside of the office. And a lot of patients say, I'm nervous, I'm anxious when I come see the doctor. I think it's just high for that reason, but we can't just say, okay, you're right, it's just high for that reason. We have to have justification for that. So we can send them home with the home blood pressure monitor. We calibrate it in the office so we know that it's reading appropriately. Send them home, have them do a week of readings, and then we get a bunch of readings to actually realize that, yes, their blood pressure is good at home, and it is just that they're elevated when they come in to see the doctor. Or no, it's actually elevated at home too, and then oftentimes those patients that were kind of in denial about their blood pressure being elevated realize that, oh wow, I guess really my blood pressure is elevated and I should really do something about it. And it kind of gets people motivated to either go out and exercise or change their diet a little bit and work on some of those lifestyle factors, or maybe be willing to take a medication that they weren't willing to before they realized that their blood pressure was high outside of the office.
So again, really, I think, powerful evidence. Now, as I said, 17 years, not all of it by any stretch a straight path, but we're starting to get some recurring themes here. Feedback loops work really well to promote behavior change, and they involve active reflection, the sentinel effect, and the ability to take action, and they all seem to have to be present. The data alone, it means almost nothing. The data alone without any kind of push for accountability, except for maybe a small, maybe 10% of the population that are quantified selfers. Except for them, we need that extra little bump, the sentinel effect, the consequences that we talked about earlier. And of course, we need to have the ability to take action, and we need to be comfortable that we can. And as I said, it's been really, this was my biggest insight. It's been impressive to me how much patients want to do this, how much consumers want to take control of their health. And as healthcare providers, we really haven't embraced that. We haven't thought it through. And many, many, many of my colleagues don't actually believe it's possible. So in closing, I do want to make a plea. Patients are our greatest untapped resource. We have this enormous cost problem. We have supply and demand mismatch in healthcare. And the biggest resource we have, because after all, who cares more about your health than you? We're not using that resource. We're still talking at patients. We're not involving them. We're not bringing them into the conversation. A sad story that I have to tell, and it's a recent one, and I'm sorry to say it. A woman who showed up in the emergency room, educated woman, having chest pain. It's determined that she needs to have a cardiac stent. She has a lot of questions. And the cardiologist says, dear, so that's the first bad problem. Cardiologist says, dear, all you need to worry about is whether I'm playing Steely Dan or opera in the cath suite. We've got to stop that. That just is unacceptable. And it's still happening. So patients are our biggest untapped resources. Connected health takes patient engagement, though, to a whole new level. There is a role for this idea of objective information and connectivity and feedback, and it's hugely powerful, and we're finding more and more of that every day. So my request, my call to action to all of you is try it. Buy the new Nano. I don't work for Apple, but something, do something. Go out and start tracking. Have the kind of insight that I had so that you learn what your own gym equivalent is, that you don't have to run to the gym. It really makes a big difference. It makes your healthcare top of mind. You will be healthier, and you'll be happier for it, and you'll bring it back into your day job, and we can together change how care is practiced. Thank you.